Have you been losing more hair than usual over the past year or so? Well, you're not alone. This pandemic has brought on a lot of stress that manifests itself in more ways than one, and it's hair loss for some of us. In fact, Google searches for hair loss, according to a data science firm, has significantly increased in the last 12 months. The good news is this type of hair loss is usually temporary and usually resolves itself in a few months. Hair loss is part of a natural cycle, which means that seeing hair on your brush or comb is usually not something to worry about. So how much hair loss is considered normal? And when should we start worrying? Here on MedTalk Health Talk, I'm Dr. Freddy Gomez, and we're here to build a healthier future for you. Losing a certain amount of hair every day is normal, but if it seems like it's more than usual, it can cause a lot of worry. Our guests are here today to tell us more. Joining us is Dr. Julieta Peralta Arambulo. She's a dermatologist and hair transplant surgeon from the Medical City Wellness and Aesthetic Institute and founder of Asian Hair Restoration Center. Also with us is Dr. Marivi Dizon. She's the section head of pediatric dermatology at the UST Hospital. For our viewers, did you know that your scalp has more than 100,000 hair follicles? And it's normal to lose around 50 to 100 strands per day. For those with longer hair, it may even be more noticeable. I'll start the discussion with Dr. Arambulo. Doktora, when should a person have concern for hair loss? Because maraming tao, maybe they see some strands of hair sa una nila, pagkagising nila, maybe in the shower drain after taking a shower. When should this be a cause of concern though?
Actually, when they're starting to lose the hair, that is a concern already. It's important that they consult so that we know we can diagnose what is the hair loss condition and we give the proper diagnosis. It's important that the patient understands the difference between hair shedding and hair loss. When it's a hair shedding, this is manifested by yung maraming nang nalulugas, nakikita nila sa pillows, sa brush nila, and sa anywhere. This is just a temporary condition.
Now, since we have a lot of hair, losing maybe a bit of hair through shedding every day may not have an effect on our appearance, but there may be a more significant reason for your hair loss when you start seeing your scalp or start seeing bald spots. Dr. Arambulo, let's discuss some of the reasons why magkakaroon na ng hair loss ang isang tao.
There are many factors affecting the hair growth, okay? So number one now during this time is the physical illness. It's a form of stress, no? But the common form of stress that most patients would come for consultation is the mental or emotional stress.
Because that's a good point, because so many people now are stressed over the past year and a half, and it's important to know that physical and psychological stress can actually cause hair loss. This can also, though, happen to children. Kaya I'd like to ask Dr. Marivi, maybe a lot of parents may see this in their child and cause them to be really anxious. Could you explain how this connection could affect children?
So right now, our situation, this historical pandemic condition that we are all locked in, I will use that word, is causing stress also for the children. All of a sudden, you have very social kids suddenly yanked away from their peers. They cannot play with them, and they are glued to their screens, to their laptops, to their computer the whole day because of online learning. This is not normal to them. They are now as well stressed, and there are stress hormones that are creating an impact on those hair follicles. So essentially, there will be the pathological hair loss.
Dr. Marivi, you make an excellent point when you talk about nutrition, because there are actually some studies that show that zinc and iron deficiency are some of the nutritional deficiencies that are linked to hair loss. But aside from that, what other nutrients can cause increased hair fall to adults as well as children?
Aside from zinc, well, also protein deficiency is also going to create hair loss. Aside from that, you will also have niacin deficiency. And it's not only the deficiency of the vitamins, but also overly giving the patients hypervitaminosis. Excellent example is vitamin A can create also hair problems.
Hormonal changes can also be one of the reasons why your hair is falling out more than usual. Dr. Arambulo, can we talk about some of these and how are they different from men and women? I'd like to talk about some of the hormone changes, especially the male and female pattern hair loss. Let's start with that, Muna.
In male, you can see from mild to most severe involvement of the top area of the scalp. And that's very obvious. You see them walking around. And those are the inherited type of hair loss, which is permanent. In female, we call it a hormone-induced hair loss. It's called female pattern hair loss. And this is caused also by progesterone. But estrogen also may take a role in hair loss in women because we have both the estrogen and the progesterone.
Now, in order to determine if you're losing too much hair, you can perform a test at home called the pull test. Dr. Marivi, how is this done? Can you tell us how much hair pulled out is normal in a pull test?
For teleconsultations, we have no other recourse but to do that. We just ask the parents or the patients to grab just a few pieces of their hair and gently pull away from the scalp. If they get more than 3 or 5 strands of hair at that single pull, then that can already be considered as something, a potential problem.
Dr. Marivi, going back to children and hair loss, is there a certain age group that we see hair loss being more common?
Absolutely. Even as an infant, the hair loss occurs 4 to 6 months after the infant is born, because even inside our mothers, we already start hair loss, hair shedding, the physiological hair shedding. So those are just the physiological types of hair loss that one needs not to get worried over.
Now, if you're concerned about how much hair you're losing, it's always best to consult your board-certified dermatologist. When we return, we'll talk about hair loss as a result of serious medical conditions. We're your connection to healthcare. You're watching MedTalk Health Talk on CNN Philippines. Hair is the only exterior part of your body that's been subjected to such a wide range of use as well as abuse. And many of us have a love-hate relationship with the appearance of our hair, but looks aside, hair has many functions. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. We're together in health. Most of us do all sorts of things to our hair to change the way it looks, but sometimes it can be damaging. Dr. Marivi, let's take a look at the function of hair and why it's important that we take care of it.
Basically, hair, weather-wise, is a protection from the cold. We're not talking about the cold in the Philippines, but now, more importantly, hair is very, it's something that society looks at. It's a cosmetic issue. And we know that if we appear to be acceptable to those people around us, then it psychologically pumps us up.
Dr. Arambulo, let's talk about basic hair care right now, no? So what's your advice on yung magandang pag-alaga ng buhok so it can prevent further problems later on? How often should our viewers wash their hair? What type of products should they avoid? Those things.
For hair care, your hair is oily. We just want we just advise the patient to wash the hair more often. But if it's dry, you add moisturizer. And of course, you don't subject your hair to many chemical treatments and no application of too hot treatments because it is damaging to the hair.
Now, one condition that causes your hair to fall out, often in clumps, the size and shape of a coin, is alopecia areata. It's a common autoimmune disorder that often results in unpredictable hair loss. And for most cases, the hair loss is nothing more than a few patches, although for some, it can lead to complete loss of hair on the scalp or even the entire body. Now, the condition can affect anyone regardless of age or gender, but most cases occur before the age of 30. Dr. Marivi, what are the symptoms of alopecia areata? Are these symptoms same with adults as well as children?
Alopecia, the symptom is the patient loses hair. And more frequently, whether the patients or the parents or the patients themselves, they will always come to our clinics already complaining and suddenly notice that there's this big splotch of hair that is gone from their scalp.
Now, what's the general cause of this, Dr. Marivi?
Whatever underlying comorbid or condition that the patient has, the T lymphocytes are attacking the hair follicle. So it can range from some endocrine problem like a thyroid-related issue, hypothyroidism. It can also be some autoimmune condition, connective tissue disorders such as the lupus. But again, I will always emphasize malnutrition is also something that we take to heart, that what would cause the hair loss or even alopecia.
Some forms of alopecia can be managed very effectively as long as it is treated early. Dr. Arambulo, what is the management for someone who comes to you with alopecia?
Okay, so first know the problem, and majority of this hair shedding problem would just need medicines that can stimulate the hair growth, and very much available and FDA approved is minoxidil to stimulate the hair growth, and then the low-level laser treatment also that can stimulate the hair to prolong the growth phase. But in alopecia areata, we used to give also topical steroids, but in severe cases might need to give injectable steroids because it has anti-inflammatory effect. And in a very severe cases, I offer patients the cellular treatment now available.
Now, trichotillomania is hair loss from repeatedly pulling on your hair. Now, traction alopecia can be developed when your hair is often in a tight ponytail, bun, or braids, especially if you use chemicals or heat on your hair. Now, these conditions can be reversed if you stop pulling your hair, but if you don't catch it early, it may cause permanent hair loss. Now, Dr. Marivi, you talked about this earlier. I'd like to expound more about this. What could be the underlying condition why children would constantly pick on their hair enough to cause hair loss?
There's this strange sensation that occurs with an individual when their finger starts crossing the scalp here and just simply pull away that hair strand. It's their stress reliever. There's this strange sensation of fulfillment when they have that pulling of hair away from the scalp. And sometimes they favor a particular area, but at times it can be on different regions of the scalp. That's one. Two, I'm glad you mentioned about the traction alopecia, because especially now that we're homebound, the use of hair bands are causing an unusual traction or pressure on those hair strands, and essentially is also creating that hair loss.
Now, taking good care of our hair is important, not just for how it looks, but for our health as well. More on this when we return. Your health is our mission. You're watching MedTalk Health Talk on CNN Philippines. Many people put tremendous stress on their hair, from styling to applying heat, and this may cause the hair to become thin, dry, or even brittle. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines, where your care always comes first. You can do a lot for your hair to minimize the damage that may lead to thinning as well as hair loss. Now, Dr. Arambulo, let's talk about some of the treatments for male or female pattern baldness. Siyempre, mahirap ito kasi because there is a genetic factor involved. But whenever someone comes to you with this problem, how do you manage this?
We first give the patient the available medical treatments. Okay, as I mentioned earlier, minoxidil and all the cellular treatments are available, the low-level lasers. All they do is to stimulate the hair to grow, and it's best given during the early stage of androgenic alopecia or male pattern baldness, while the thinning hair is still there. My first recommendation is treat it with the available FDA medical treatments.
Grow back again. But let's talk about the surgical treatments naman, because I'm sure a lot of viewers are curious. Ang hair transplant surgery, those who underwent this, is the strength of the hair just as good as the original hair?
Hair transplant is the permanent solution to hair loss in male pattern baldness. Once transplanted, it's there already. It will remain because the hair, the donor is from the back and sides of the scalp that is not affected by the hormone DHT. So even if you transplanted it to the areas affected by male pattern baldness, which is the top of the head, it will not be affected.
Dr. Marivi, I'd like to ask for the parents out there who are very anxious and worried about their kids' hair. What's your advice to them for their children to have very good and healthy hair?
For one, fear not. Basically, if we're going to ask for basic scalp care from the infants, number one, you have to use gentle cleansers, gentle shampoo. We have to keep in mind, especially in infants, that shampoo may run down the face and especially the eyes. We do not want a cleanser, a shampoo that's going to irritate a developing eye as well of an infant. So you have to make sure that it is a gentle baby cleanser or a gentle baby shampoo that you are using.
Thank you very much for joining us, dermatologist and hair transplant surgeon Dr. Julieta Peralta Arambulo and pediatric dermatologist Dr. Marivi Dizon. Losing a few strands of hair every day is somewhat normal, and if you're worried that you're losing more hair than usual, please talk to your board-certified dermatologist. Factors like stress, medication, and underlying medical conditions can all worsen hair loss. We want to be your partner for a lifetime of good health. And I'm Dr. Freddy Gomez. This has been MedTalk Health Talk on CNN Philippines.